This tutorial was prepared to help chiropractors learn how to meet the documentation requirements for Medicare. The tutorial takes the actual documentation verbiage from the WPS Medicare website. Since all of the Medicare processors follow the same guidelines, it should not matter which state you have established practice in or whether the claims are sent through WPS. The guidelines should be the same. We'll be looking at the guidelines and illustrating the documentation requirements using the Clinic Pro EMR software and ICER2Go's in case of emergency record. According to Medicare, the patient must meet the medical necessity threshold for treatment by having a neuromuscular skeletal condition and a reasonable expectation of recovery or improvement of function. As their guidelines state, strain or sprain problems may take up to 3 months of treatment with decreasing visit frequency during that time frame. Other, more long-term problems involving degeneration may take a longer treatment time, but not necessarily with a higher frequency of visits. A finding of pain is not sufficient to support medical necessity. The location of pain must be described, and it must be determined whether the particular vertebra listed is capable of producing pain in the area presented. There are 2 ways to substantiate a subluxation. First, X-rays can be provided of the area of the spine where the subluxation exists. The second type of documentation involves part information gained through physical examination. Part means pain, asymmetry, range of motion, and tissue or tone changes. To fulfill the part requirements, you must have at least 2 of the 4 ingredients of either pain, asymmetry, range of motion, and/or tissue or tone changes. In addition, one of the 2 must be either asymmetry or range of motion. You must document either subluxation or range of motion abnormalities. You'll also notice that Medicare specifies the type of examination that is appropriate or acceptable to substantiate the examination findings. Now, let's look at the actual documentation required for the initial visit. First of all, Medicare addresses the patient history, the subjective part of the examination. Medicare wants to know the symptoms causing the patient to seek treatment. We will cover that more thoroughly under Chief Complaint. Then, the guidelines ask for family history if relevant. That's the part that gets tricky, the if relevant clause. A family medical history usually looks at problems that have a tendency to run in families such as cancer, heart problems, diabetes, and so on. Are those relevant to a spinal problem? Does the fact that the father has had back problems as a result of work injuries predispose the child to have spinal problems? Probably not. To be safe and to cover all documentation bases, you might want to complete a family history record such as you see on this screen. When presented as a report, the family history would look like this, showing the health problems of each family member. The next part of patient history addresses prior illnesses and treatments that have been performed by the medical community. Medicare wants to know conditions that have been diagnosed, treatments that have been performed, surgeries, and hospitalizations. You can ascertain this information by asking the patient specifically about previous diagnoses, surgeries, and hospitalizations. As part of the online medical record created through ICER2Go, the medical history prints as you see here. One of the phrases in this group of requirements is somewhat troubling in its ambiguity. There's certainly a lack of specificity when it comes to the phrase general health. What does general health mean? Are you supposed to ask the question, how would you describe your general health? To make sure that Medicare cannot indicate that documentation is lacking, a complete review of systems will more than adequately cover your office. In a complete review of systems, the patient is prompted to enter the symptoms that are present in the various systems of the body. A complete review of systems totally covers general health regardless of the way it is defined by Medicare. Finally, Medicare indicates that a medication history needs to be obtained from the patient. Even though we all know that chiropractors cannot prescribe medications, the Medicare documentation guidelines require that a chiropractor obtain a medication history from the patient. ICER2Go software makes it easy for patients to enter medications by presenting a browse list of medications to choose from. The next phrase, required as part of the subjective and objective findings, is mechanism of trauma. 3 short words. mechanism of trauma can be the difference between whether you pass a Medicare audit or fail miserably. Basically, Medicare is requiring a specific incident that prompted the patient to seek care from your office. In the patient's own words, what accident or injury happened that caused the pain that they are currently experiencing? This gets to be a difficult question in some situations. Sometimes a Medicare patient will wake up in the morning in excruciating back pain and not have a specific incident that they feel precipitated the pain. They just woke up and couldn't get out of bed. You have to play detective and ask some of the questions you see on the screen. Have you changed any of your activities lately? Are you doing things you don't normally do? Who was with you when you first noticed the pain or discomfort? Mechanism of trauma, in the patient's own words, should be the incident that prompted the patient to seek care from your office. It is a Medicare requirement and the reason that chiropractors may fail an audit. The final portion of patient history requires that the patient indicate the chief complaint, including any radiations. In addition, the frequency and duration of the complaint must be indicated. A description of the pain is helpful. Medicare also mentions aggravating and relieving factors as part of the guidelines. The Clinic Pro EMR combines all of this information on one screen for your convenience. All of the information discussed so far is included under the patient history or subjective part of your examination. Then you enter the objective part of the examination, the evaluation of the musculoskeletal nervous system through physical examination. Luckily, Medicare does not delineate the specific orthopedic or neurological tests that you must perform. You may choose the orthopedic and neurological tests and the way that you record the results as long as part of your testing includes an evaluation of range of motion or an indication of subluxation or asymmetry of the spine. Remember, if you're performing a part exam, you must have a positive finding in either range of motion or subluxation as part of documentation for medical necessity. You must also have at least 2 of the 4 ingredients of the part exam. Once you've performed the physical examination, the doctor must assign a diagnosis to the patient. The first diagnosis needs to be subluxation or non-allopathic lesion as it is described in the CPT manual. The second portion of the diagnosis must be a neuromuscular skeletal diagnosis. For the neuromuscular skeletal diagnoses, Medicare divides them into short-term, moderate, and long-term treatment categories. In other words, Medicare bases the treatment plan that they're expecting on the neuromuscular skeletal diagnosis that you assign to the patient. Remember, Medicare expects most short-term problems to be resolved in a 3-month period of time. For the moderate diagnosis codes, Medicare expects a longer period of time to resolve or correct the problem. As you scan through the list of moderate diagnosis codes, you'll notice inflammation and sprain-strain type codes. A moderate treatment plan should return the patient to the optimal level of functioning or to the level of functioning that existed prior to the traumatic incident, the mechanism of trauma. The long-term diagnosis codes include degeneration of various kinds. By Medicare's definition, a chronic spinal joint condition such as loss of joint mobility or other joint problems implies that joints have already set and fibrotic tissue has developed. These conditions may require a longer treatment time, but not with higher frequency. Again, those are the exact words taken from Medicare documentation. The final portion of documentation for the initial visit is the portion that is heavily audited along with mechanism of trauma. It is the treatment plan portion of the documentation. According to the guidelines, the treatment plan has to include the recommended level of care in terms of duration and frequency of visits. It must include the date of the initial visit as well. The more difficult requirement is the second sentence on the screen: objective measures to evaluate treatment effectiveness. Medicare is requiring specific treatment goals that are measurable and observable. It is not difficult to set an objective goal for a range of motion since it can be measured in degrees or levels of impairment. It is much more difficult, however, to set a treatment goal for subluxation, since how do you measure a subluxation and show objective progress towards resolution? For the other 2 portions of the part exam, it is possible to set treatment goals based on level of severity for tissue and tone changes. For pain, you can use the pain scale to set definitive treatment goals. If the patient is currently experiencing a 7 on the pain scale, setting a goal of 3 on the pain scale is both observable and measurable. Both the doctor and the patient can attest to the fact that the treatment goal was attained. If you want to go one step further, you can also set treatment goals based on functional activities. This is not a requirement, but the ability to perform functional activities is certainly observable and measurable and extremely important to the patient. Again, this is not a Medicare requirement. This concludes the documentation required for the initial visit in terms of the patient history, the physical examination, and establishing a treatment plan with goals. Be sure to watch our second tutorial, which covers the documentation requirements for subsequent chiropractic visits and talks about the Medicare audit triggers. Thank you for watching the Clinic Pro Medicare Chiropractic tutorial on initial visit documentation.